I hope I am audible. And good evening, all students. So I can see Bhedia. So that means I am audible. So, but overall, as I understand, the paper was little bit moderate to tough, but forensic was doable. I understand the forensic was still doable, and most of them were from previously asked questions. I've been able to gather around 8 questions, and if you have more questions, please do let me know. So I think one of the question was that if a severely burnt body is found, then what kind of autopsy we will do. So please remember that dissection is done in almost all cases. Apart from that, you can do additional CT, MRI, etc. to help. So that is, and this is virtual autopsy. Okay. So virtual autopsy doesn't mean that dissection will not be done. Dissection is done. But apart from dissection, we also do virtual autopsy to see, and this is especially helpful if the body is severely burnt, because if the body is severely burnt, then it's very difficult to see the things. So there the CT scan is very helpful. So if I someone is mentioning that fracture was also mentioned, so in a very severely burnt body, if you have to see the fracture, it's difficult by naked eye. In a severely burnt body, if the body is severely burnt, in a severely burnt body, if the fracture difficult by naked eye, okay, CT scan or radiology will be better. Radiology will be better. I don't know what other choices were there. This traditional photography is not autopsy, so this cannot be the answer. Virtual autopsy looks like the answer. So photography is not autopsy. Okay, नमस्कार जय गुरुदेव. सो नो मोर रपट झंडूर्स. क्या बात है. सब भेड़िया बन गए, तो हम भेड़िए के सरदार हो गए फिर. So virtual autopsy should be the answer, but I don't know if there is any other question or what are the other choices. If you can tell me from these two choices, the answer is definitely virtual autopsy. So any other choice, if you remember, you can tell me. Okay. Okay. Here, I think, please remember abrasion collar. This is a firearm entry wound. Abrasion collar are present in all the distances. All the distances. So this does not help. But please remember, if we have the choices like tight contact, loose, close contact. What's the difference between these two? In tight contact and loose contact, both of them, all three, singeing, blackening, and tattooing are present. In tight contact, these are present only on margins. And close contact, they are present around the wound. Okay. But in intermediate range, there is only tattooing. And in distant range, nothing will be there. Neither singeing, nor blackening, nor tattooing. So as per this question, only tattooing was there. So answer becomes intermediate range. So this is also a previous year question, and this is also a previous year question only, or previous year PYT, not Q but PYT. This is a PYT. So I hope everyone got it right, and this is a classical previous year question. Whenever the figure is like this, then it is voles, and I don't know if exactly this image was there. And so these all images I showed you in the class. This is loop, this is walls, and this is arches, and irregular mixture of all these is composite. Okay, so I hope this image was there. Holes image, it was loop. So that I can get to know only if I get the image. So it's very, I don't know what was there, but you just remember like this. This is walls, and the loops is like this. Loops is like this. Arches is like this. This is arches. This is arches. And this is loops. Okay. It was composite, sir, loop plus arch. I don't know because I don't have the image. Somebody gave me this image that it was walls, but if arch was, see, the chances that examiner will give composite is less. Chances that examiner will give composite is less. Composite is very rare kind of thing. So first image was there. This one, if this was there, then it will be loops. If this is there, then the answer will be loops. If this is there, then the answer will be walls. This is walls, and this is loops. Okay. But anyhow, when I get more clarity, you can just let me know. And if it is there, then this is arches, not this image. Okay. But you got the whatever it was. So what was it? Maximum people just tell me what was it? It was arch. Okay, arch tha. So maximum people are saying it was arch. So we will understand, we'll assume that it was arch. Maximum people are saying it was arch. So arch is the answer. So this was not there. We will assume something like this was there. Okay. Ha. So I did not give the exam na bhai. So but I got the recall questions from bhediyas like you. ठीक है? तो arch is the answer. Maximum people are saying arches. तो तुम भेड़िए हो तो ठीक ही बोलोगे. Arches is the answer. We will go by that. Now, cross dressing. Cross dressing is transvestism, also called eonism. Okay. Now, it can be, if it is done for the purpose of sexual gratification, then it is called transvestic fetishism. Fetishism. But it can also be done for other reasons like some mental illness, gender identity disorder. But so ideal answer for this question is transvestic fetishism. But as I know, this choice was not given. So the second best answer is transvestism or eonism. So if in that case, eonism will become the answer. In case of fetishism, it is not cross-dressing. It is like footwear, undergarments, objects of objects of opposite sex. It is objects of opposite sex. But here the person is wearing the clothes of opposite sex. So we'll mark eonism as the answer. Chalo. And here the person can have sex with any woman but not with his own wife. So fetishism was there, but fetishism will not be the answer. Transvestic fetishism will be the answer. Transvestic fetishism was not there. No. Transvestic fetishism was not there. So the second best answer, we will have to mark eonism as the answer. Fetishism cannot be the answer. Fetishism means from the objects of opposite sex. And here the person can have sex with anyone but not with one particular woman. So this is quad hank. I don't know what the other choices, but this is a simple PYQ. So again, so this is also PYQ. This is also a PYQ only. So forensics were all PYQ, I will say, which I all teach in the class. Now here it's morphine, that is an opium CNS depressant. So here there will be all vitals are decreased, pupil size is decreased, and in vitals there is a decrease of blood pressure, heart rate, respiratory rate, and body temperature. But so from this, tachycardia cannot be the answer because the heart rate is decreased. Pupil size is decreased, so pupil dilated cannot be the answer. So people would have got confused between pupil constricted and bradypnea. क्वाड वाले दो ऑप्शंस थे सर. ठीक है, अभी उस पर दोबारा आएंगे. लेट्स फर्स्ट डिस्कस दिस. So bradypnea and pupil constricted both are seen, but from clinical relevance, what is more important? Bradypnea is more important. No, I have told you consistently, low respiratory rate is the most characteristic sign of opium poisoning. Low respiratory rate is the most characteristic sign of respiratory for the opioid poisoning. If you remember in the class, I say whenever you see respiratory rate very low, like less than 10, always think of opioid because the treatment is guided by the respiratory rate. If the respiratory rate is too low, patient may require ventilatory support. If the treatment is, if the respiratory rate is too low, patient may require respiratory support. So the answer becomes bradypnea. Pupil constricted option में नहीं था, meiosis नहीं था. अच्छा, so what was the answer? What was the question? Unequal pupil size. Unequal. So even unequal pupil size is very non-specific. Unequal pupil size is very non-specific choice. Okay, different size of pupil size is also very. Respiratory depression is, or bradypnea or respiratory depression, whatever it was, that is the most characteristic of opium poisoning. Okay, somebody is saying that in there were two choices with quad hank. Can you tell me what were the two choices with quad hank? What were the two choices with quad hank? Anyone? There were two choices with quad hank. अरे जवाब तो दो ना, जय गुरुदेव तो ठीक है, पता नहीं. ठीक है, इसमें if the person there is an accused of sodomy, so what will you take to confirm sodomy? How will the sodomy be confirmed? Simple thing, quad doctrine. So please remember the answer is quad hank. There was something quad doctrine. I don't know what is quad doctrine. I have no idea. But the answer will be quad hank. Answer will become quad hank. So that is a simple PYQ. Okay. So this is also PYQ. So forensic is all PYQ. So here, how will they only one test to one confirmatory test for sodomy? See, there are many signs of sodomy, like lateral traction test is positive, loss of perianal fold, all those things. But those are not confirmatory. What is confirmatory? Confirmatory is only one thing, when you can detect the semen near anus. That is the only confirmatory thing. All other things will be suggestive. They will not be confirmatory. So how will you get the semen? By rectal swab, rectal or anal swab, whatever it was. I don't know if the choices are correct or not. Are the choices fine? Choices are fine or not? Tell me. Choices are fine or not? Okay, so in that case, the answer will become rectal swab. Clear? Now, shoulder joint accident. Now, this is a bit controversial because I could not get the image. But I will tell you one thing. What you could have seen? What you could have seen, that I will let you know. So here one is, what do you see in shoulder joint? You see humerus. You see acromion process and coracoid process of which bone? Scapula. And you see outer end of clavicle. Outer end of clavicle. These things you can see in the shoulder joint. So outer end of clavicle will not help us, give us any information. It is the inner end of clavicle which helps, not the outer end. So outer end of clavicle will not help. In humerus, there is head, greater tubercle and lesser tubercle, which appears at 1 year, 3 years and 5 years, which, and they fuse with the shaft at 17 to 19 years. Most likely these three centers were present. What I could understand from the people is that head in the humerus, if we talk about the humerus, the head, greater trochanter and lesser trochanter were present but not fused. Not fused. So not fused means the age is less than 19 years. Age is less than 19 years. Then the very important will become acromion process and coracoid process. So here you have to remember that acromion, most likely the acromion process and coracoid process. Please remember, acromion process appears and fusion 15, 18, 11, 16. So acromion process appears at 15 years and fuses at 18 years. Fuses at 18 years. The coracoid process appears at 11 years and fuses at 16 years. So, what I could understand from students is acromion process was not fused, not fused, but coracoid was fused. Coracoid was fused. Okay, something like this was there. Acromion was not fused, but coracoid was fused. So this is what I could understand. Okay. So in that case, the if this is the right, if this is was this it was, then the answer will become 16 to 18 years. So this is a bit tricky. Why it's bit tricky? Because normally shoulder joint is not very commonly asked for. So though it is a previous year topic, but I will call it bit moderate to difficult level because shoulder joint, though it is a part of PYT, but it is not commonly shown as an image. Normally we show the image of elbow joint or X-ray or wrist joint. Okay. So 16 to 18 looks like the age. सर इन लास्ट क्वेश्चन सीमन भी था ऑप्शन में. अब ये तो फिर एग्जैक्ट क्वेश्चन चॉइसेस बताना पड़ेगा. फोर्थ ऑप्शन was सीमन टाइप. I don't know. Semen type, because in rectal swab also we are going to check the semen only. So in that case, आधे से ज्यादा क्लेवल देख रहे थे सर एक्सरे में. क्लेवाइकल हैज नो रोल. प्लीज रिमेंबर, क्लेवाइकल in shoulder joint you will see the outer end of clavicle. That does not give any information. Clavicle inner end gives us the information, but that you could not see in the shoulder joint x-ray. Okay, so it was mainly the game of acromion. So that's the reason I am saying it is a bit difficult question. बस हो गया. एनी अदर क्वेश्चन यू रिमेंबर? देखो फोरेंसिक तो यू ऑल आर भेड़ियाज. ऑलमोस्ट आई डिस्कस 8 क्वेश्चंस एंड all of them were P by T. Anything, any other question you remember? कोई और क्वेश्चन याद है? Okay, so if there is no other question, rectal swab with epithelial cell था कुछ नहीं. अगर सीमन चॉइस में था तो फिर सीमन मार्क आंसर हो जाएगा. इफ सीमन वॉज देयर इन द चॉइस देन द आंसर विल बिकम सीमन. वन ऑप्शन रेक्टल स्वैब विद सीमन एंड एपिथेलियल सेल्स. देखो अगर कहीं पे सीमन था तो सीमन बिकम्स द कंफर्मेटरी. अगर सीमन वॉज देयर तो सीमन विल डेफिनेटली बी द आंसर. दैट विल बी 100% कंफर्मेटरी. तो दिस वॉज अ कॉमन सेंस क्वेश्चन. बेसिकली दिस इज अ वेरी कॉमन सेंस क्वेश्चन. ठीक है. तो सीमन अगर है तो सीमन तो ही सीमन से ही तो पता चलेगा ना सोडोमी हुई है. सीमन अगर मिल गया तो सोडोमी हुई है, नहीं तो सीमन कहां से आ जाएगा एनएस के पास. कमाल करते हो. हाउ विल सीमन कम इफ देयर हैज नॉट बीन सोडोमी? ओके, सो थैंक्स ऑल.